Welcome. Today we're diving into the intricacies of mitral regurgitation, a common heart valve disorder. We'll explore what causes it, how it affects your heart, and what can be done to manage it. So, let's get started on this journey to better heart health. Mitral regurgitation can stem from a variety of causes. Some individuals are born with abnormalities of the mitral valve, a condition known as congenital mitral valve disease. More often, it develops later in life. Common culprits include mitral valve prolapse, where the valve leaflets bulge back into the left atrium, rheumatic heart disease, a complication of untreated strep throat, infective endocarditis, an infection of the heart valves, ischemic heart disease, resulting from a heart attack or reduced blood flow, and dilated cardiomyopathy, a condition where the heart muscle becomes enlarged and weakened. Less common causes encompass certain medications, radiation exposure, and autoimmune disorders. Now, let's talk about how mitral regurgitation affects your heart. Normally, the mitral valve acts as a one-way door, allowing blood to flow from the left atrium into the left ventricle and preventing backflow. In mitral regurgitation, this valve doesn't close properly. This results in blood leaking backwards into the left atrium each time the left ventricle contracts. This backflow increases the workload of the heart. The left atrium enlarges to accommodate the extra volume. Over time, the left ventricle also enlarges to pump harder to maintain adequate blood flow to the body. If left untreated, this chronic strain can eventually lead to heart failure. Mitral regurgitation is surprisingly common, affecting millions worldwide. The prevalence increases with age. Mild regurgitation can be found in a significant portion of the elderly population. While some cases are congenital, the majority develop over time due to factors like age, related valve degeneration, ischemic heart disease, or prior infections. The symptoms of mitral regurgitation can vary depending on the severity. Many people with mild regurgitation may experience no symptoms at all for years. However, as the condition progresses, symptoms can appear. Common signs include shortness of breath, especially during exercise or when lying down, fatigue and weakness, heart palpitations or irregular heartbeats, a cough particularly at night, swollen ankles and feet, and lightheadedness or dizziness. Diagnosing mitral regurgitation involves a combination of physical examination and diagnostic tests. A doctor may hear a heart murmur during a routine checkup, which can be the first clue. An echocardiogram, which uses ultrasound to create images of the heart, is the primary diagnostic tool. It can visualize the mitral valve, assess the severity of the regurgitation, and evaluate the size and function of the heart chambers. Other tests, such as an electrocardiogram, an ECG or EKG to check heart rhythm, and chest X-ray to assess heart size, may also be performed. In some cases, a cardiac MRI or transesophageal echocardiogram may be needed for a more detailed evaluation. Mitral regurgitation can be classified based on its severity and cause. Severity is graded as mild, moderate, or severe. The cause can be primary or secondary. Primary mitral regurgitation involves a problem with the valve itself, such as mitral valve prolapse or rheumatic heart disease. Secondary or functional mitral regurgitation occurs when the valve is normal, but the supporting structures are damaged or distorted due to conditions like dilated cardiomyopathy or ischemic heart disease. Understanding the type and severity is crucial for determining the best course of treatment. Treatment for mitral regurgitation depends on the severity of the condition and the presence of symptoms. Mild regurgitation without symptoms may only require regular monitoring with echocardiograms. Medications, such as diuretics to reduce fluid buildup, ACE inhibitors or ARBs to lower blood pressure, and beta blockers to slow the heart rate, may be prescribed to manage symptoms and reduce the workload on the heart. For severe regurgitation, especially when symptoms are present or the heart is becoming enlarged, mitral valve repair or replacement is often necessary. Mitral valve repair is generally preferred over replacement when possible, as it preserves the patient's own valve. Surgical approaches can be either open, heart surgery, or minimally invasive, including robotic-assisted surgery. In some cases, a transcatheter mitral valve repair, like the MitraClip procedure, may be an option for patients who are not good candidates for surgery. While not all causes of mitral regurgitation are preventable, there are steps you can take to reduce your risk. Preventing rheumatic fever through prompt treatment of strep throat with antibiotics is crucial. Managing risk factors for heart disease, such as high blood pressure, high cholesterol, and diabetes, can also help. Maintaining a healthy lifestyle, including regular exercise, a balanced diet, and avoiding smoking, is beneficial for overall heart health. The prognosis for mitral regurgitation varies depending on the severity, the underlying cause, and the overall health of the individual. Mild to moderate regurgitation may not significantly impact life expectancy, especially with regular monitoring. However, severe regurgitation, if left untreated, can lead to heart failure, arrhythmias, and even sudden cardiac death. Mitral valve repair or replacement can significantly improve the prognosis and quality of life for those with severe disease. Recent advances in minimally invasive valve repair techniques are improving outcomes and reducing recovery times. Research continues to explore new and innovative ways to treat mitral regurgitation, including transcatheter valve therapies and improved surgical techniques. These advancements offer hope for better long-term outcomes for individuals living with this condition. Remember to discuss your specific case with your doctor for personalized advice and management.